Good morning. Today we are talking about the nervous system, and I am going to be using my notes as a visual. So, we're going to start off with the central nervous system. The central nervous system is made up of your brain and your spinal cord, and it serves as the control center for everything. So, I have my little person right here. So, central nervous system, brain, spinal cord. Then you have peripheral nervous system, which is your PNS. The PNS is made up of cranial nerves and spinal nerves, and it helps get the information from the CNS to the rest of the body. So all of these out. In the PNS, one of the parts is the motor division. I'll just say that the motor it comes from the CNS to the motor so that you can move. Specifically, the SNS system, which is the somatic nervous system, is made up of somatic motor nerve fibers. Somatic means this is voluntary. So these are voluntary movements, and it helps conduct the impulses from the CNS to the skeletal muscles. So, for example, brushing your teeth. This is a voluntary movement. You wake up in the morning and you brush your teeth. You think about it without realizing. You think about it, you're grabbing your toothbrush, and then you begin to brush your teeth from side to side or in circular movements. But you are using your hand, your arm, your fingers, you're using your muscles in order to brush your teeth. If you had motor neuron disease, this affects the nerve cells in the brain and the spinal cord. So the brain and the spinal cord. So that means that the messages are no longer being able to be sent out when you have motor neuron disease. So the messages from the brain are failing to reach the muscles. In our example, the muscles in our hands. So it can no longer be able to go to the muscle in our hands. So what does that mean? The muscle in our hand is no longer going to know that it needs to move because it's not getting those messages with motor neuron disease. Something that can help motor neuron disease is physical and occupational therapy. There is nothing that will reverse motor neuron disease so that you are able to regain everything completely as going back to normal, because this usually happens with age. So when you're older, you can get occupational and physical therapy in order to help the motor neuron disease. So you can have exercises like stretching and just doing gentle exercises of small movements so that you are able to have some control. Another thing that can help, since this is common with older age, is an electric toothbrush. An electric toothbrush, you don't have to be so precise about your movements. You kind of can just hold it and be able to drag it back and forth. But we see why the somatic nervous system is a really important part that makes up the nervous system. This helps with our voluntary movements. Okay, so thank you for watching my video and listening to my example of the central nervous system.